Hi everyone, welcome to tonight's live with Professor Anna Campbell. I am just going to get her started with our discussions. Hello Anna.
Hi there. Can you hear me, see me okay?
Perfect, yes, I'm just adjusting mine as well because I'm a bit high. How are you?
I'm very well. We've had a beautiful sunny day here today. I don't know if any of you saw in Edinburgh where there was a Queen was obviously in the big church, and yeah, the weather's been as nice here in Perth, which is just slightly north. So it's been really, really nice.
Good, and she's left you now. She's heading down south to us.
Yes, exactly. Yeah, I think it was interesting because where I live in Perth, I could see her coming from Balmoral and up on the hill, and we all kind of the crowds were there even all the way along the road. So end of an era, I think
I
that
know, I know. And the reason we had to cancel our live last Thursday. So
exactly.
thank you for everyone for bearing with us. But we're excited to be chatting tonight. And I mean, I obviously deal with the patient face to face on a kind of grassroots level. But what we want to talk about today is some of the amazing data and research that's coming out in cancer and exercise. And having done my own science degree and being a little bit of a science geek, I do love a bit of data. So
Yes.
thank you so much for joining us. For those of you who haven't come across Professor Anna Campbell, MBE, before, Anna is a professor in clinical exercise science at Edinburgh Napier University, so up in Scotland. And you have nearly 20 years experience in the field of oncology. And I was reading that you were a biochemist before as well. So very science based. So Anna also gets involved in a lot of Macmillan projects. But the reason that you're here today is because you're a real researcher. You're involved in a lot of the research that's going on, not just in the UK, but across the world. So yeah, I mean, you can tell us more about you. So go ahead.
It's interesting because I am basically a lab scientist. So I worked in the lab, immunology, biochemistry, and some of you may remember Dolly the sheep. Well, I actually was part of the team that helped make Dolly the sheep. I
Oh
love
wow.
that. So that's what I did in the biotech industry, cloning and etc. But that's another story. And basically, what happened was I left the biotech industry and decided to do a master's in sport and exercise just because I loved the topic. And a friend of mine who was a nurse, a cancer nurse, breast cancer nurse, said to me, and it's 22 years ago, she said to me, Anna, all my patients, when they're on chemotherapy, should they lie in bed, rest, and do nothing? Is that the right evidence? And when I looked in the literature, there was nothing. There was about 3 papers on exercise and cancer. And that's where I started thinking we need to research this a lot more. And that's where I've been involved directly in research, in looking at what are the benefits, and indirectly by trying to get all the evidence into practice. So a lot of my colleagues at uni call me a pracademic because I don't like just to do the academic. It's really important that all that great information, evidence gets put into practice. And so, yeah, that's why although I've worked in the lab, I also work very much at the coalface with people with cancer.
Yeah, and training people like me. So Anna's company, Can Rehab, has set up this amazing course for exercise professionals to take them to that level 4, the next level, where we are trained to work with people with cancer. And it's not just exercise professionals now, there's physiotherapists as well as part of the course too.
We've had surgeons, nurses, radiographers, physiotherapists, fitness instructors. I've just done over the last month a training course in Thailand, unfortunately
Oh,
virtually, in Lebanon virtually. We've now been asked by the American Cancer Society to
oh
be
wow.
a provider in America. So we must be doing something right as far as our training. And I do think you're a brilliant example of somebody who's taken that training and uses it brilliantly. And healthcare professionals love it when they meet people like you that they can hand over their patients to.
Yeah, and I am honoured when there is somebody who actually knows, you know, the healthcare professionals. It's still, the word is being spread, but we need to keep spreading the word to those healthcare professionals who can support and pass patients over to us when when they're ready for us.
Yeah, and I mean, we might talk about this more, but the NHS is struggling
Hmm.
financially and staff wise, and yet there's a huge untapped group of people like you who could really, really help them. So, my main task at the moment is professional development and getting people like you acknowledged by the healthcare professionals.
Yeah,
That's critical.
and connecting. So, you have also been traveling around the world this summer, speaking at conferences and also listening to a lot of the most recent data and research. So, what's been the most promising and exciting studies that you've come across in your travels?
I'm glad you've asked me that because this year I have been in Canada, in Denmark, in Spain, and going at various conferences, all to do with cancer and exercise. And when I started, as I said, we wanted to see, is it feasible? Can it improve quality of life? Can it stop fatigue? Can it help build muscles and heart and lung? That's all been proven really strongly. But now we're finding exercise is almost like one of the treatments, the medicines. There's some amazing studies, mostly in mouse models, but now moving into humans, where they look at what happens to the actual tumor when you exercise. And they're finding that people who exercise, the chemo and the blood vessels are getting the chemo right into the core of the cancer, because cancer tumors are usually in the middle. It's really difficult to get any of the treatments in there because it doesn't have any blood vessels. Actually, exercising allows the treatments to get right into it. Also, we're showing that the immune system cells are in there if you exercise much more, natural killer cells, T cells. So exercising is actually aggressively helping to attack the tumor. So that's one
Wow.
of the big things we're just finding out from doing markers, doing fluorescence, doing mouse models. Exercise can help fight the actual tumor. The second big thing is that now we're looking at, does it help you complete your treatment? And there's lots of new studies come out showing that the dose reduction in a randomized control trial, so if you take 100 people, a half get exercise during their chemo, the other half don't, the ones who get the exercise, the reduction in the dose is virtually nothing compared to the ones that do not do any exercise. And also the amount that they get is the true amount, whereas those who didn't get it, they had to have a reduction of not only the dose, but how often they got it.
Oh, wow.
Imagine that. It is actually helping long term, because obviously the dose that they want to give a patient with cancer is the recommended amount to get the best results.
Yeah.
People don't get that recommended amount because they can't. But this trial, a couple of trials have shown, actually if you're exercising, if you're given the appropriate program, you'll be managing to take a better lot of that dose that is expected of you. So this is
Mm.
what we call, and it's the oncologists are really beginning to pick up on this and think, wow, this is new evidence, because obviously long term it could be affecting survival rates.
Yeah.
You get the right dose, there's a chance you'll live longer than those who are not able to get the recommended amount. So
Yeah.
fascinating new studies.
Well, that is fascinating. And I've been reading your blog because you write a lot for Can Rehab, and the evidence is amazing and is outstanding. But there's one study by Catherine Schmitz, who's a very amazing leading oncology and exercise physician in the US, and she said that only 14.7% of patients in her study were actually referred to an exercise program. So although all of these amazing benefits are being presented, patients are just not getting access to this. Is it the same in the UK?
I would, up to recently, I would have said yes. However, there's been, and I must say that finally oncologists and surgeons suddenly realized that a lot of their patients who have to go through surgery were so unfit that they couldn't give them the surgery for their cancer, or if they did, they had to spend a lot of nights in hospital and they had a lot of conditions like pneumonia. they suddenly said, should we not be making our patients fit for surgery? And now throughout the whole of the United Kingdom, these prehab studies are
Yeah.
up and running. So in other words, anybody who's getting colorectal, esophageal, pancreatic, lung, some of the more complex surgeries, they're getting an exercise program before they go to that. But then tagged on afterwards is the rehab. So Katie is right. I mean, to be honest, I think, you know, in the UK, we still have a big issue with referral pathways. Everybody says, I don't have the time in the NHS, and they don't. The surgeon doesn't have the time, the oncologist, the physiotherapist, a lot of them do not have the time to sit down with somebody and say, right, now I have to triage you to the right type of program for yourself. However, this is where, with a new professional practice that I've set up, where there will be healthcare professionals called clinical exercise physiologists, and we're hoping that they will be part of the healthcare system so that anybody with any chronic condition, but let's talk about cancer, anybody who's got cancer will have an interview with that person, and they will triage them to the appropriate program for them, which could be either hospital-based or community-based. This is just beginning to happen, and so it's going to take a few years before that pathway is set up. But in the meantime, there are a lot of really good programs out there, and there are a lot of really good qualified cancer exercise specialists. So what we need to do is just get a way of getting, as you said, the cancer nurse specialists, the radiographers, the chemo nurses, the physiotherapists to say, I can pass you on to somebody who will sit down and design a safe and effective program for you. So I think we are, but the ultimate aim is in the UK, I would say my dream is that at least 70% are getting asked about that and part of the cancer care package. That's my main drive at the moment.
Yeah. I get a lot of people come through to me who are quite proactive and obviously are very up to date on the benefits of exercise, and they're putting themselves forward. So I suppose creating some way that we can make those connections, which I know you're starting to do as an organisation, to make sure that if a patient wants to find somebody like me, or a doctor wants to find an exercise professional local to them, that there's that kind of joining up of the dots, and that people know about where to find that information, because you're starting a registry, aren't you, of all of the exercise professionals who practice in oncology.
Exactly, and that's where the charity, which was set up, basically what happened with lockdown and people being isolated, suddenly I realised, me and my colleagues in the University of Portsmouth and Macmillan, that we needed, University of Southampton, we needed to do something fast. So we basically set up a trial where anybody affected by cancer, we matched them with a Can Rehab qualified instructor, and they got 6 months of online support, and it worked incredibly well. So that money, that trial is coming to an end, and we now have with the charity, how can I sustain this? And there's a number of options I'm looking at, because this register of Can Rehab instructors, if we had somebody who only spoke Urdu, and we could match them to a Can Rehab instructor that spoke Urdu. Somebody was very keen and mostly doing cycling, a lung cancer patient, we matched him with a guy that did a lot of cycling. So somebody was advanced cancer, we could match them with a palliative care nurse who is also a Can Rehab instructor. So there's huge opportunities to do a kind of dating matching.
Yeah.
So to have a map where if anybody says, right, I've got my cancer, I'm in the middle of my chemo, Can Rehab Trust, can you tell me which instructors are in my area that I can contact?
Yeah.
And that's what we're trying to do, is get funding so we can make a kind of map of that.
Yeah. And I guess the great thing about, well, not the great thing about lockdown, but the thing that developed from lockdown was so much online training, because I know from my point of view, my business suddenly just shifted, and now I work more online than I don't. So you don't even need to be in the same town as them. We can train people online in their own homes.
Absolutely. And you were part of the Safe It initially, right?
Yeah, I was. And my client was up in Scotland and everything. So what I wanted to ask you a little bit more about, Anna, was the we get a lot of questions around stage 4 clients and exercising and whether exercising is safe. And I know recently there's been a new study that talks about resistance training, so strength and resistance training in people who have bone mets. Can you talk us a little bit more through the findings of that study?
So what we did as a study is we've decided, a group of us, and it was funded by Campbell and her team in University of Vancouver, decided to look at what is the evidence out there about exercising when you've got bone mets, and what can we advise for people who have bone mets. So it's to put it in a nutshell, you definitely, what you have to do is, if you are a fitness instructor working with somebody with bone mets, you need to find out, number one, what cancer do they have?
Mm-hmm.
Where are the bone mets? Are they in pain? Are the bone mets stable? Are they blastic or lytic? So these are various parameters that the instructor, then knowing them, will design a safe and effective program for them. So you can definitely exercise, and you can even, with appropriate guidance, if you have very advanced, unstable, lytic bone mets, if you have the appropriate instructor, they can still get you to do some stuff. So what I'm trying to say is it has to be a risk stratification. And most of the CAMRIAB instructors, and we're going to do some more CPD to tell everybody about what they need to look at. But number one is pain. If somebody has a lot of bone mets pain, that has to be managed first before any instructor would say do any exercise. Then it's a case of, right, are they stable and how many are? And depending on where they are in the body might mean that you concentrate on upper body or lower body or pelvic area or not. And we'd work that out. So yes, it's not just one size fits all, but it is that you definitely can exercise, but you need to get the appropriate advice.
Yeah. And that's definitely something that I learned very early on, is there is no one size fits all. You know, we can have two patients next to each other with the same diagnosis and they have completely different movement patterns or exercise programs. But as you say, for the stage 4 clients, I think the overall findings for this study was that it in most cases, used in the right way, resistance training was beneficial for these patients.
Very much, because that is one of the areas where muscle mass loss is not good. And the more you can maintain as much of your muscle as possible, so you don't have any problem with sarcopenia, which is where muscle is replaced with fat, or cachexia, which is more with the advanced cancer where you lose a lot of muscle mass. So maintaining muscle mass, keeping strong, is really, really important. And I would say with advanced cancer, it's probably more important to keep the muscle strong and your balance good than concentrating on getting cardiorespiratory fitness up. So if I was to prioritize, I would try and get them strong and good muscle balance, coordination, and then some cardiovascular as well.
Yeah, okay. That's really useful, thank you. And we talked a little bit about that research kind of coming from Canada. We've talked a little bit about the States. What are the differences across the world in terms of exercise oncology, and which countries are leading the way?
Yeah, that's again a good question. So I would say one of the countries I visit a lot, and I'm really amazed, is that in Denmark and some of the other Scandinavian, but Denmark's the one I know best, exercise is a treatment. It's not a rehab, it's not an add-on, but everybody during chemotherapy gets exercise as part of the treatment. It is mostly run by the physiotherapists in that area. And again, but that's where, you know, that's their role, and they are very good at doing that. In another country, like, I think that's Scandinavian and Germany are probably the best. In Canada, there are some pockets of extremely good community-based exercise programs. Australia, but that's mostly research.
Yeah. Oh, really? Okay. Yeah, and then in the States we've got Katie Schmitz, and there's a lot of different professionals over there as well.
Yeah, and I'm part of Katie's team, which is moving through cancer, where we're trying to increase it in the States because it's huge. And so there are little areas where it's going on. One of the really good things you have is Live Strong at the YMCA. MBE. So they do that, but they have a problem that they don't have the appropriate fitness professional training.
Mm.
So that's where there's bits that are working and the bits that are not. But they have a lot in that they don't have the workforce yet. And that's why the American Cancer Society have asked Can Rehab to be involved. And also policy. You know, we are now getting to a stage, I think, with the prehab where actually exercise is beginning to be part of a policy. And
Yeah.
once policy, then things begin to start to get more on board.
Yeah. And in terms of Can Rehab as an organisation who trains professionals like myself, have you seen a higher uptake in people wanting to actually take the course now that the research is kind of gaining momentum?
Absolutely. I mean, and I think once it went online, it was something we always said we'll never do, we have to do it, but we have tailored it really well online. And what's allowed us online is we have oncology nurses, oncology physios, people working in the Royal Marsden as an exercise oncologist, people who are cancer patients who talk the story. So we really have managed to get the experts in, and the uptake has been, you know, we're always full. We have a maximum of 30 and every course is full. So there are more and more of these guys out there. And just for anybody who thinks, you know, how good are they? To pass the Can Rehab course, you have to do, as you will remember, a 3,000-word essay. You have to have a short answer questions. You do a multiple choice, and you have a face-to-face viva where you've got to randomly pick 2 of your case studies and describe various things. So it's not easy, and you've got to get 70%. So we do get people who are graduates at uni or doctors who have to say, sorry, you failed, you're going to have to go back and do more. And they do realise, you know, when any of the healthcare professionals see that, they say, wow, these guys are good. You know, it's my baby, and I make sure that everybody gets past who can get past, you know.
Yeah. I just remember finding it and thinking, wow, that is what I was meant to do all along. Just had cancer first and realised that it needed to exist. So, I mean, it has completely changed a lot of my clients' lives, my life as well. I didn't know when I was going through my own treatment that I should have been exercising, and actually, as you said, I probably could have tolerated my treatment a lot better. So it's good to have that own personal experience from both points of view as well.
And
Oh, sorry, go ahead.
you know, the number of people who I worked with who never exercised in their life, and then when they got cancer, they said, right, what can I do? And just the improvements and the much they say, wow, this has just really helped me so much. So,
Yeah,
and I think that's the problem you said, that we may be at the moment getting the people who are already fit, who were fit, but when we did our trial, we made sure that every single person was asked. And that's what I really want, because there are a lot of people out there who never exercised, who, if with the right support, the benefits they'll get are huge, you know. So yeah, that's we need to get the hard to reach as well.
and I think trying not to make exercise scary, you know, when you talk about strength training, and there's so much information about strength training and how beneficial it is for people who have been through a cancer diagnosis, I think sometimes the immediate thought is heavy weights, big barbells, and that's just not necessarily what you need to be doing. You can lift lighter weights, we can progress nice and slowly, you can use resistance bands. Somebody's asked whether they can exercise with a PICC line, and pretty much with the right guidance, yes, making sure that weights aren't too heavy too soon, but it is a case by case basis, and making sure that you have the right guidance is
yeah,
really, really important.
I know the PICC line again. That's something I'm doing a bit of research, because
Oh,
a
interesting.
lot of people ask about this, and to be honest, you know, the guidelines were initially, wherever you've got your PICC line, do not do any movement in that area, and I thought that can't be right. So we're trying to look at how can we give the best advice. And the only thing I would say is, I think what you just said is, make sure you don't do very, very heavy weights where you can actually be putting pressure or shifting or moving. Likewise, if you're doing any aerobic or running or moving, make sure there's no rubbing. It's
Yeah.
really, you just don't want any shifting, so there's a slight risk of infection. But otherwise, there's just, you're normally washing your face or putting on your clothes. So any movement like that, just keep doing it. And as I say, you can even do weights. Just make sure it's not getting to a point where you feel it's actually shifting the line in any way.
I think that's a really good way to look at it. I saw there's another exercise professional, she's a clinical exercise professional actually, Sarah Russell, who said something the other day about don't always look about what you can't do. Look at how you can get round some of the things that
Yes.
you need to, but make sure you can get to where you want to be. And that's kind of what our job is, to help people do that and to guide them around slight curves and things that they need to change in their fitness routine, but making as much possible as possible.
Exactly.
And I did get a message actually from a lady who I think she was a professional rugby player, and she talked about can exercise raise your cytokinin levels, your CK levels? And we talked briefly about that beforehand, because that can be a marker of cancer returning. And I think there was a little bit of a fear that she'd been to an exercise class and her levels had raised.
I know. I had a chat with Professor Kristen Campbell, who's over from Vancouver, staying with me at the moment. And there's no strong evidence at all. I mean, it'd be interesting. We thought, I wonder how she measured that, because if she's part of a trial, that would be interesting. But if
Mm-hmm.
she's measuring it herself, I think it's probably not that significant in the whole scheme of things,
Mm-hmm.
the exercise. But if she is concerned, she should definitely go back and see her nurse or her oncology just to see if she's noticing that rise. That's something to see. But a lot of people have been asking about a new thing is creatine, and can you take it? And
Yeah.
again, with all the evidence about exercise and cancer survivors and using creatine. And really, the jury is out if it has any major benefits. It definitely doesn't have any negative effects, because creatine, a lot of people who are real weight trainers will use creatine to help repair the muscles after they've been doing a lot of heavy resistance training. So I would say only if you're doing heavy resistance training should you be using it. And if you are using it, you probably get very small positive results. But it certainly isn't anything that can cause any major hazards or side effects or have a negative effect. The jury looks as if that's definitely okay, but how effective it is, we're still not sure.
Okay. And there was another question around peripheral neuropathy. So for people who haven't heard of that before, so some treatments can cause the nerve endings in the fingers and the toes and the feet to lose their feeling or tingle, like a bit like pins and needles, and that can obviously affect your balance. It can affect your movement patterns, and there's been a lot more research in that area just to find out benefits of exercise in terms of trying to recover some of that feeling and reducing the peripheral neuropathy in those areas.
Yep. So again, it is something that particularly some chemos and peripheral neuropathy can happen and it gradually gets back to normal. Other ones, it ends up with numbness forever or slight tingling. So again, I've looked at the research and the reviews, and there are some trials showing that the perceived numbness and tingling does seem to have decreased. I think one of the things that have been used are these vibrator plates. Remember, we used to have
Oh
them.
yeah.
I don't know if they're still around, but some people have done trials with that and shown that actually with exercise and using that, they are actually improving and repairing the nerve cells faster and getting more of the blood supply into the area. So again, it's a bit like the trials are shown are kind of mixed in the responses, and some are showing that there is an improvement in perceived. So whether it is, because obviously how to measure whether it's getting better or not is how does that person feel? And a lot
Mm.
of studies are showing that perceived improvements in that there's less numbness and tingling when they exercise. So again, I would just say that it suggests that there's no harm done. And I think the best thing is to try and keep doing the exercise that you like. Maybe try, if there is any of those machines that are still around doing the vibrator, try a bit of that, because it might just regenerate the nerve cells that little bit faster.
Yeah.
I don't think it used to be very popular, but I don't
I
know. I think
know. I used to do your abs exercises on them and shake and wobble. To be fair, I've been to a gym for quite a long time. I do everything outside. So
me too.
Um, so one of the questions that came back, which I think is quite an interesting one, perhaps to come to a close with, is: are there any trials for cancer and exercise that people can be part of? So if they want to join in the research, are there any trials that they can sign up for, and how do they do that?
Yeah, that's a really interesting question. I would say there are lots of trials. Trials now, remember, when we're doing a trial, we usually have to have a very specific group. So sometimes it's premenopausal women with breast cancer, sometimes it's esophageal cancer or early stage brain mets. What I would do is the main thing you could do is find out from your oncology team or your university, are there any exercise cancer projects going on? Because there's no major thing. Cancer research usually publish trials, but once they've been got the grant.
Yeah,
So I don't know of any kind of database where you can just log in and see what's in your area, unfortunately. But I certainly, yeah, I mean, I basically, because a lot of the studies I've done have been in breast cancer, and some of my students now are people that are going to be working with teenagers and young adults with
hmm,
breast cancer. But the answer is it's just a case of ask your oncology team or your local university. That would be the
yeah.
main.
Or the physios actually might know quite a lot about it. I sit on a call quite regularly with a team around the country, and there's a lot of things going on, particularly in prehab, as we mentioned at the beginning, and then trying to get people exercising during their treatment.
Yep, absolutely. Apologies, all the physios. I should have said you as well.
That's all right. Brilliant. And just to finish with my favourite question, what would be your key advice for anyone beginning their cancer journey? So perhaps those who have just had a recent diagnosis and where it can feel quite daunting, particularly if somebody says, go and exercise. Last
Yeah,
thing on your mind. But
absolutely. And it is daunting. And the one thing is that this is an opportunity for you to take control of one aspect. You're going to be overwhelmed and appointments here, there, meetings here and there, treatments here and there. But this is going to be one way of you taking control of your body. And yes, all the things that are going around will be obviously top priority. But again, it's just holding your hand with somebody who can help you through the various phases where you're up and down. And it's not a case of you're going to start day one and by the end of your treatment, you're going to be ultra fit. There'll be ups and downs. And as you said, ways around. And it's not a case of as soon as you're diagnosed that you want to suddenly start on a very extremely challenging program. It could
no,
be slotting in every day a little time for yourself to do something that you feel you're in control of what's happening with you. And that's kind of the thing, is just that little time for yourself doing the things you enjoy, whether that is just a walk with the dog or yourself, to a little online session, or going to the local golf course, you name it, there's something for
yeah.
everybody.
Yeah, I think you make a key point there. It's making sure you enjoy it, and actually that, yeah, it is time for yourself. It doesn't have to be aggressive exercise. It doesn't have to be scary gyms. It can be walking, as simple as that. And I think that is, the foundation of a really good exercise program is getting outside every day and just going for a walk, and, listening to a podcast, doing anything that you want to do, but just getting everything moving and the heart pumping.
Exactly. And that's where, especially in prehab, is trying to get that heart pumping, because the more you're fit with your heart and your lungs, the better
Hmm.
surgery. And then afterwards, then it's a case of what are the areas where you might have lost a bit of range of movement through your surgery or through radiotherapy, which are areas that are feeling a bit tight, or through your chemo, have you lost a bit of muscle mass, or through hormone treatment, are you gaining weight, have you got hot flushes, night sweats, all these different things. But that's where exercise has been shown to be beneficial for all these different things. So it
Yeah.
really is like a medicine.
Exactly. And there is not necessarily a specific one size fits all. There's not a specific exercise that's going to do X, Y, Z, but it's about doing something that you enjoy and keeping your body moving.
Yeah, because you want to, we want to make it so that it's something you enjoy and you will become an independent exercise. It'll be part of your day-to-day life. I mean,
Mm,
for you like me, I did a little run today. It just becomes part of my day that I do something. It'll be different every day, but it's just part of who I am now, and that's kind of what we want.
exactly. That's my ultimate aim when my client says to me, I'm going back to my exercise class. Yes.
Exactly.
All achieved.
Yeah,
Brilliant.
exactly. The confidence. I mean, I tell you, I mean, I know people who were triathletes who, when they got cancer, were so afraid to do anything,
Mm,
and just giving the confidence back,
yeah,
not just the exercise prescription, but yes, you can do it. It's definitely fine. That is a big, big plus. And they're really, yep, off you go.
yeah. And I think that's where that relationship between the healthcare professionals as well is so important, so that the conversation continues and people don't get that fear to go back to exercise because of the benefits that they can gain from it.
Yeah, absolutely.
Brilliant. Well, thank you so much, Anna. It's been an absolute pleasure talking to you. And thank you to everyone who joined us today and for all your questions. We hope we've answered all of them. If you've got anything else, then please do post them in the comments afterwards. I'll post the video of this conversation on my feed and send it on to Anna if you can do it on yours as well. But please do shout with any further questions, and I hope to see you all soon. So thank you so much, Anna.
Thank you, everybody. Lovely. Thanks for coming along. Bye now.
Bye.
Bye.